Hi, my name is Ayesha Anwar, and today I'm going to be packing and irrigating and changing an abdominal wound dressing. So I've already collected my supplies and I've reviewed the physician's orders. So I'm just going to go ahead and enter the patient's room and do my entrance safety check so the patient doesn't look like they're in any distress. They have a call bell within their reach and their bed's been lowered to the ground. So I'm going to introduce myself. Hi, my name is Ayesha Anwar. I'm going to be your student nurse today, and I'm going to be changing and packing and irrigating your abdominal wound dressing. You've already signed a consent form for this, but I'm just going to ask you to verbalize your consent. Do you want to proceed with this? Patient said yes. So I'm just going to look at their wristband to verify I have the right patient. And their wristband will have their name, their date of birth, and their FIN number. So I have the 3 patient identifiers, and I'll ask them to verbalize their name and their date of birth as well. Okay, so I have all the information. I'm just gonna, I already gave my patient their analgesics before, so I can go ahead and start the procedure now. So I'll bring everything up to my waist level to ensure sterility, and I can just go ahead and start opening my wound care kit. Okay, so I'm just gonna start by adding supplies that I'm gonna be using for the wound care dressing. So first I have my Kaplan. This would be in a sterile packaging. It would be unopened, but I've already used this a lot, so I'm just gonna go with that. And then I'm just gonna put my sterile Q-tips to help me measure and pack, and I have my measuring tape on the side of the table as well. Okay, and then I'll just pack, or I'll grab another pair of Q-tips, and I'm just gonna make sure my hands don't touch the packaging because it has been opened before. So I'm just gonna make sure that I maintain sterility. Ideally, these would also be new and not used. And then I'll add my scissors. And then I'll add my acrylics. So this would be in a sterile packaging as well. So I'll just make sure that I'll just grab it with my forceps and put it in my boat. And then I'll grab my syringe. So my 30cc syringe for irrigating. Put this in here. And then I will go ahead and add my normal saline. So I'll make sure I don't spill anything onto my sterile field. Just add a little bit. Okay, so I've already put together all my supplies. Now I can go ahead and open my patient's wound dressing and just remove the old dressing and have a look at it. Okay, so there's no drainage on here. It looks dry and clean, so I can make a note of the NDIPN. I'll throw this out. And then I'll just grab and pull out the packing. So this is also clean, and there's some serous drainage on it. I would say about 70%. I'll make sure I make a note of the NDIPN. I can throw this out as well. And I'll just assess the wound site so it looks like healthy granulation tissue. The wound edges are intact. There's no sloughing, but I'll make a proper assessment after I'm done cleaning it. So I'm just gonna remove my old gloves, and I'll do my hand hygiene. And I'll just put on my sterile gloves. So these would be in a closed or sterile packaging as well. And I'll just make sure I open them properly. Okay, so I've put on my sterile glove. I'll grab the middle and just throw this out. And then I can just go ahead and start putting my supplies together. So I'll put up 15cc of normal saline into my syringe. Ideally, I would be pulling up 30, but for the purpose of the demo, I'll do 15. And then I'll just start irrigating it. So I'll irrigate it until the drainage runs clear from the middle, so top to bottom. Okay, so the drainage is clear. I'm happy. I can throw this out. And then I'll just grab my sterile forceps and a 4x4 and just dip it into the wound bed to make sure I soak up the excess normal saline. And I'll just dip this in here and make sure that my forceps don't touch the wound bed, so the gauze creates like a buffer to ensure that all the sterile water gets pulled up. So it looks dry, I'm happy. Now I can go ahead and start cleaning my peri-wound area. So I'll grab a 2x2, dip it in some normal saline, and just clean the far side. So one swipe, top to bottom, and I'm done. And then I'll do the same on the other side. So I'll grab another 2x2. Okay, one swipe, top to bottom, done. And then I'll dry it in the same manner. So one swipe, top to bottom, done. And one swipe, top to bottom, done. So I'm just gonna put these back. I'll assess my wound. So again, looks like healthy granulation tissue. Wound edges are intact. There's no sloughing or undermining or tunneling, or I'm gonna measure that, but everything else looks good. There's no foul odor coming from the wound either, so everything looks good. So I'm just gonna grab a Q-tip, and so I'm gonna assess the undermining and tunneling on one side. Okay, so there's no undermining or tunneling on this side. I can throw this out, and I'll grab my next Q-tip and do the same on the other side, top to bottom. No undermining or tunneling on that side either. And then I'll just measure the wound length. So it's about 7 centimeters. And then the width is about 3 centimeters. And then the depth is about 2 centimeters. Okay, so I've measured it, and I'll make sure I put all my notes in the IPN, and now I can just go ahead and start packing. So I'm gonna grab my acrylics and dip it into normal saline and just make sure it's soaked. I don't have much left because I've used up most of it, so I'm just gonna go ahead and use what I have. So I'll start packing. So I'll just make little folds and make sure that my gauze doesn't go past the 2-inch area that I cleaned, the peri-wound area. So I'm gonna make sure that my gauze stays within that so it doesn't get contaminated. And I'll just make sure I pack all the empty spaces and make sure that everything gets covered and there's no loose ends. Okay, so the packing looks good. I'm happy. Now I can just go ahead and take my 2 4x4s and just place them on the wound before I cover it with mefix. So I already have, at this point my hands can be considered clean, not sterile. So I already have my 2 pieces of mefix cut, and I have my date and time and my credentials on it to make sure that the next nurse knows when this dressing was changed. So I'm just gonna go ahead and put that on. so everything's good, everything's covered, and the patient tolerated the procedure well. I'll make sure to document the wound appearance, so if there was any, what kind of drainage there was, the wound measurements that I took when I was measuring it, and what kind of tissue there was, so there was granulation tissue, any foul odor coming from the wound. I'll also make sure that I chart how well the patient tolerated the procedure, what kind of dressing I used, and when the next dressing is due. And I'll continue to monitor for any drainage. So I'll do my exit safety check, I'll clean up by the patient's bedside and lower their bed, put their call bell in their reach, and I will go ahead and start charting.